Treating diabetes is not easy. There are many different types of medication, but also many different therapeutic goals, because not every patient is the same. This over here is the pancreas. It produces insulin, and insulin then helps absorb glucose from the bloodstream into the cells of organs such as the heart. Clearly, the pancreas is a vital organ. But what if this vital organ stops producing insulin? Or if the human body becomes resistant to the insulin that is produced? Glucose then cannot be absorbed from the bloodstream into these other vital organs such as the heart, and we define that as a form of diabetes mellitus. Type 2 diabetes is caused in part by the body becoming resistant to the insulin that is produced. So a clear response that the human body can perform is to produce more insulin, and sometimes way more insulin than usual. And we can help the body do this with medications called the GLP1 analogues. But sadly, in medicine, one size rarely fits all. And while this medication might stimulate pancreas to produce more insulin, it also might have side effects that the patients simply cannot tolerate. One more dangerous reason why this medication should not be taken is poor functioning of the kidneys. Patients who have type 2 diabetes usually present with obesity, cardiovascular problems, but maybe most importantly, damaged kidneys. Persistently elevated glucose levels can ultimately cause arteries in the kidneys to become damaged and clogged. So it can be extremely frustrating first to be diagnosed with type 2 diabetes, only to realize then that you cannot be treated with metformin or GLP1 analogues, which is actually more commonly used, and metformin is a great medication. Luckily, there are medications called dipeptidyl peptidase 4 inhibitors. They're not GLP1 analogues, but they inhibit this enzyme called dipeptidyl peptidase 4, and that way they reduce the breakdown or inactivation of GLP1 that our own body produces. The GLP stands for glucagon-like peptide, and it helps stimulate insulin production by the pancreas over here. It is a hormone that the human body can produce in the gastrointestinal tract. Evidence suggests that a direct contact of nutrients with the gastrointestinal tract causes the secretion of this hormone. It is also stimulated by digested nutrients. And it makes sense, Once these nutrients are digested, they're going to increase the level of glucose in the bloodstream, and therefore this GLP hormone will stimulate the production of insulin, and that way try to reduce the level of glucose in the blood. This medication, however, might not be as good as metformin or other options for diabetes, and it also has its own side effects. Doctors and patients, we have something for you. If you're a doctor and you want to make videos like these, then go to Symptomsky.com. But if you have more questions about diabetes, then go to Symptomsky.com/help/diabetes.